If you're curious why we have shot glasses on the set of MedTech TV, it's not because we start drinking this early in the day, most days. It's because some of the great places we travel to for conferences are represented by the shot glasses that we bring back. So on this episode of MedTech TV, we're going to talk spine conference. Welcome to MedTech TV. I'm Paula Rutledge.
Greg Drolshagen.
Chris McClough.
And today we're going to talk about conferences. So as I just mentioned, every time we go to a conference, and this year we've been to about a dozen so far, we've got one or two left that we're going to talk about. We bring back a shot glass. It's kind of just a little tradition here. One of the great things about medical device conferences is some of the very, very fun places that they're held. So Greg, I know you love the California shows. You went to a neuro show and a musculoskeletal show this year. And do you have a preference, Northern or Southern California?
I would love Southern California just because the weather's beautiful, and on the off days when you're not at the conference, you can go to the beach, which I'm a big fan of, which is why I live on the East Coast now.
Exactly,
So, yeah.
exactly. I know you're a beach guy, to be sure. And Chris, I know you like Chicago, but you like pretty much traveling anywhere.
Yeah, I'm fine being a road warrior and just getting out there and put the face with the phone, right?
Exactly. And of the dozen or so conferences that we've gone to, one that was held here in Orlando, which is great because we got to stay in our hometown, was recently the NASS show, the North American Spine Society show. And so I think that's a regular for us. We go just about every year. And Chris, you had some really interesting observations about NASS this year. Starting with the fact that the attendance on the exhibit floor was down a little bit this year. What do you attribute that to?
You know what? It could be Disney World, right?
The weather was really great
It could be. Yeah, it could have been Disney World. Everyone might have been at Disney World. So I think it could have been everyone was on vacation. It could be the time of the year, but it was a little bit low for surgeon attendance this year. And then the booth setup, it was this massive wall in between the first half of the exhibit floor and the second half of the exhibit floor. So, it was a little bit quiet in the back. Because it almost looked like the conference ended, and then it was a little bit more loud in the front. And most of the larger exhibitors, the Strykers, the Medtronics, the J&Js were out in front, and then some of the smaller new entrants were further a little bit in the back.
Yeah, I felt bad for the people that are on the back side of the show, and hopefully they'll fix that for next year. I know, Greg, when you go to conferences, you typically like to go to the smaller booths. Why is that?
Because I'm a big fan of the small companies. I feel like we can make the most impact as an organization with the smaller companies, get personal with the executives that are normally there and some of the people that are pretty high up in the organization, versus when you go to like a Medtronic or a GE booth, there's 100 people or something gathered in there. You can't get too personal with them.
That's true. That's true. And the show that you went to in California, did you stay? I know you like going to the first-time exhibitors. And Chris, this year, I know you had some really great observations about some early-stage companies that we wanted to let our viewers know about. So, what was one that you thought was the most impactful from a new technology standpoint?
Right. So I think there was a couple trends in the market. One was additive or 3D printed manufactured technology. We saw a lot of those and a lot of new entrants going into this year. This would be like a 4Web, a Renovis, Acuity. Ironically, two of those being out of Dallas, the other one being out of Austin. CoreLink Surgical. There was a few in there that were making plays in the advanced technologies or the additive space with 3D printing. Another trend we saw was single-use disposables, right? So an efficiency play. Single sterile-use prepackaged disposables going into the hospital system. It's a nice economic value proposition as we see some of the hospital systems crunched for dollars, right? So I think when you can cut costs, you can make a pretty compelling value proposition if the efficacy is the same on the outcomes.
And these single-use disposables, you're seeing that. I know, Greg, you cover neurovascular and neurology applications. Have you seen that also on the neuro side?
Yeah, absolutely. I think from an innovation standpoint, we're trying to get a little bit more minimally invasive and a little bit more on the single-use disposables, a little bit lower on the price point. It's a competitive market, and I think the best way to enter it in one that's pretty crowded is by having an efficient product that has that patient safety component, but also is lower, much lower on the cost.
Yeah, cost is really factoring into
it's a
everything
cost factor,
these days, to
correct,
be
yeah.
sure.
Yeah.
So you also came back and noted that the biologics were really making a big push. Seems like that just about every major company, a lot of smaller innovative companies, are really heavy into the biologic space. What was a company that you thought was, again, a leader in that industry?
Right. So there was two companies that stuck out. One's a little bit more of a mid cap. They're publicly traded, MiMedx, with their Purion process, amniotic membranes, and you get all the regenerative factors of cellular-based medicine. The second one was Therapeutics. With their iFactor technology. Thought that was kind of an interesting play into the market. They're a little bit smaller. I think they've got a pretty solid executive team. And they've been growing slowly but surely. But as we move to evidence-based medicine into the market, the investment on the front side from a clinical efficacy standpoint and a safety standpoint is becoming more and more critical to penetrate a market, especially as a new entrant. And, if you're a one-trick pony, you've got a single product, it's really important to invest not only in the regulatory side to get the approval, but the clinical data to go in there and say this is why, especially as we move with single-use vendors and dual source vendors on the contracting side of the business with hospital systems, to really impact the patient care with data and say this is the exception to the rule and this is why you should work on the hospital contracts.
But it's interesting because we're not political here at all, but not off camera or not on camera anyway. But MiMedx has really taken a nosedive in their stock recently. It has nothing to do with their clinical efficacy. Well, that's a tough word to say. So maybe we have started with these. But MiMedx has had a whole lot of play, and I know we talk stocks a lot, Greg, because I know you're a stock guy. But MiMedx has had a whole lot of issues from an activist stockholder who seems to be trying to short and drive down the price, and yet the booth was incredibly busy.
Yeah.
Physicians really seem to be gravitating. I know they've got some new products coming out for diabetic foot ulcers that should be released shortly. But it's interesting to see how this play, how diverting it can be to have political and this activist stockholder really tried to divert the company, but I was impressed by the fact that their sales group was incredibly prepared for those types of questions and brought the conversations right back to the clinical component, which, touche for them. And you were mentioning a little bit about Therapeutics as well. So some of the advantages of the Therapeutics product? Right,
so it's a peptide-enhanced bone graft. What's nice, it can be stored at room temperature, no mixing, right? So you've got a shelf life of 3 years and everything is pre-mixed. But what I liked about it is if you actually look at their IDE trial and look at the outcomes there, you'll see a couple of interesting things on safety and also efficacy.
And on the IDE, so that's an investigational device exemption for those of you that weren't familiar with that. So to go ahead and continue.
Yeah, well, I would say take a look at the evidence. Again, evidence-based medicine.
Yes.
Take a look at the profile. Take a look at the IDE trial. The IDE trial. Some of the outcomes. It was about 300 plus enrollment in the trial, and we like it. It's an early commercial company. Again, they've invested on the clinical data, and I think that'll be one to watch. So again, the major trends we've seen: single-use or efficiency plays, disposables, additive manufacturing in terms of 3D printed technologies. Even the big guys are doing it. And then certainly the biologics or the regenerative medicine aspect. I think those were the three most prominent trends coming back from NASS, and it was local, so
can't beat that.
Can't beat that.
Can't beat that.
Right.
So we've got a couple more conferences this year. I know, Chris, you're going to be heading out to RSNA, which is the big radiology show in Chicago this year. What are you looking forward to seeing at RSNA this year?
Yeah, so I think there's a couple things that I'll probably talk about in the next episode.
Okay.
But in the general scope of things, we'll talk about artificial intelligence. We'll talk about big data and how that's making an impact in the device space as opposed to just the IT space, and then wearables.
Yeah, and I know that you'll be anxious to hear what Chris comes back with from RSNA, because you work obviously in the capital markets with some of the big iron companies as well, the imaging companies. So it's going to be an exciting next couple of weeks here at MedTech TV. We look forward to seeing you on the next episode.